Yeah, trendsetter, whoa, league of my own, it don't get better. No, read what I wrote, I'm a bestseller. Yeah, reach for my goals, hit it dead center, hit it dead center. Bullseye, hit it the most, is no misses. Something like fish in a barrel, it's no different. Blindfold on me, I still got the most vision. Trendsetter total.
So before we talk about the actual diseases, first we need to know what is facial dermatosis. So facial dermatosis is a skin condition which affects the skin of the face. So face in sense, eyes, around the eyes, the periocular area, perioral area, muzzle area, nasal planum, and the ears will be affected. In case of cats, even the head and neck region, along with the head, the neck region is also affected. So this present a unique diagnostic challenge because there are underlying etiologies are varied. So it varies from a simple localized infections to a complex autoimmune disorder. So in case of cats, if you take, it represents a more generalized disorder. When you see a cat with head and neck lesions or pruritus, or known as a HN pruritus, it tells you that the cat is having a more severe disorder, not only it restricted to a head. So why we are talking about the face skin? So there are certain features which makes the skin so delicate or sensitive to the allergens. The facial skin is thin and also it is sensitive, and also at the same time it can trap fluids. Certain breeds, anatomical features of certain breeds are predisposing for the facial disorders to occur. Like breeds like bulldogs or Persians or Sharpies have numerous skin folds and wrinkles, and so there the water particles or dust or any this humid environment can prevail in that folds, which helps in the growth of bacteria or fungi. So they are prone for fold pyoderma, what we call as a fold pyoderma. And also the alkaline pH is normally 7 to 8, which is it's towards the alkaline side. This alkaline pH will maintain, or it will not allow the bacteria or fungi to grow. But once we start using a lots of shampoos or human shampoos, this alkaline pH can go down, and also the skin barrier function can be affected. So that time all the bacteria or fungi can affect your skin, and it causes diseases in the animals. Also, there are certain behavior things like self trauma, pawing, rubbing, or over grooming. The dog keeps on scratching its face, or it goes and digs in the mud. That time it can have a mild trauma where it will allows the bacteria or fungi to grow. So any uh, skin condition, a dermatological condition, you have to go in a systematic way. So first step is, there are four steps. So the first step is signalement and history. So in a dermatological condition, the signalement and history plays a major role, and around maybe like 50% of cases you can identify with the signalement and history. So what is signalement? It's nothing but age, breed, and sex. So it is very easy to tell age, breed, and sex, but with that we can have a clue that this type of disorders can be present in this breed. So breed specific disorders are present, or facial dermatosis, this breed. As I said earlier, the dogs with more of wrinkles and folds can have a pyoderma, facial fold pyoderma. And age factor. So young dogs can be prone for dermatophytosis, demodicosis, while the this one adult dogs or old age dogs are prone for more of tumor cases. Likewise, middle aged dogs are like the endocrine disorders will be present, and endocrine disorders in turn can cause demodicosis. So you should be certain, well, like what is the age of the animal, breed of the animal, and also sex. Sex means like sex hormone related dermatological disorders can be also detected with by whether it is neutered or not neutered. And history. So history also plays a major role. In history, you have to ask certain questions to the owner. So owner is the person who knows basically about how much it is having pruritus, or like on the scale of 10, how much pruritus it is present. So on the table, when you keep the animal, it might not be having itching, but at the home, it might have itching. But maybe on the reverse, at the home, it would not have any itching, but on the table, it will have severe itching. And the owner will tell, it is not at all itching at home, but here it was itching. Based on the itching, also you can tell certain this type of disease is present. So on the history, you have to ask where first you have to ask where the lesion started. So the present complaint will be different, but you have to ask about the past history also, where the lesion started, how it spread, what are the symptoms, other symptoms, whether it is pruritic or non-pruritic, whether you have given any medications like steroids have been given, whether it had undergone any surgery previously, or any other disease condition is present, systemic disease condition, or what else, dermatological skin condition, whether you have given oral tablets or ointments or syrups, whatever it is, or injections, parental or topical, you have to ask. And frequency of the bath, whether it has been given bath frequently, or very like once in a month, or two months once, or frequently a daily. Some owners have a habit of giving bath or washing their legs daily. Once it goes to the walking, they will wash the legs. So it will create a humid environment, so fungal growth can occur in the paws of the animals. And also you should ask what is the diet given, whether it is a non-veg diet or a veg diet, whether it's a commercial diet or homemade diet, what are the snacks and treats it has been given, what are the fruits, or what everything should be asked in that manner. Then then environment, whether the dog is maintained inside the house or outside the house. If it is outside the house, what and all it comes in contact with, whether it trees or flowering plants, or this one around the surrounding environment, any pollutions like floor cleaner, and then in contact animals inside the house and outside the house, whether when it goes to walking, there will be lots of dogs, cats will be prevailing in that area. You have to ask all these questions. By the questioning the owner, around 50% of the cases you can diagnose, or at least the differential diagnosis you could make. And the second step in any dermatological condition, the second step, the pattern recognition, what we are going to talk today is the pattern recognition. What do you mean by pattern recognition is how the lesion is present. What is the nature of the lesion? So we know, we are already, people would have attended many webinars on primary lesion, secondary lesion, and mid-set, both primary and secondary together. So primary lesion is because of the disease which is occurring, and secondary lesion is because of the primary lesion, animal might scratch and to have self trauma. So excoriation, ulceration, erosions will be present. So primary lesions will be a macule, papule, pustule, vesicles, bullae, blisters. All this will be as a primary lesion. Secondary lesions, because of itching or scratching, it can cause ulceration, nodular lesions. Everything will be present in the secondary. And mixed like alopecia, hyperpigmentation, hypopigmentation, hyperpigmentation, all this will come under your mixed, or both. It can be both primary or a secondary patterns. The third step is, once a dog has come, you have collected your signalement and history, and you have seen the what are the symptoms it is showing. The past symptom you are going to ask from the owner, and the present on the table where you are observing what are the symptoms or the lesions that is present. So now how you will go about the diagnosing the actual disease. So you have to go for certain tests. So there are around 10 tests. These are important tests which you should do it every case. You should not miss even a one. Of course, if you know, if you're 100% sure this is a disease, you can mix one or two. But still, you have to do all these tests. Those are the immediate diagnostic tests. So what are the immediate diagnostics? One is the skin scraping. So skin scraping, you know, it is the deep scraping and superficial skin scraping is there. This is mainly for the mites, or whether it is this one. superficial mite or deep mite, all the mites you can see. Then it is a direct impression. So a direct impression is with the help of a slide, you go into touch the lesion, whether it is a moist eczematous wound. In case of feline hypersensitivity reaction, you can have a moist eczematous wound. There you can see, or pyoderma. You can, any moist lesion you can touch and take a impression. Tape impression is any scaly lesions. If you suspect for this one. Malacesia, you can go for tape impression, stain it with a stain, and then diffuse stain, and you can view under this one oil immersion. Then ear swab examination is mainly for the otic mites. Especially in Persian cats, we know that otodectus is very common. Even in dogs, you can see even demodex inside the ear. So all this ear swab examination for mites, and also you can check out the pyoderma, whether pus is present or not, or any hemorrhagic lesions are there inside the ear. You can see coat brushings, many people are missing this coat brushings. Actually, this is very easy. With a simple toothbrush you can vigorously brush the coats. You can find out for any fur mites, and in dogs also, if there is going to be a lots of dandruff, you can go for coat brushings to view the chilatella mites or working dandruff mites. But the coat brushings, many people, as I observed, that people are missing. So you kindly go do coat brushings in any animal's dog, be it a dog or a cat or even birds. You can see mites. Rather than plucking the feather to view the mites, you can just go for coat brushings and view mites in birds. Then trichogram. So trichogram is both for you can see mite, whether it is present, a mite is present, like dermatosis, when the lesion is like around the periocular region or interdigital space where the scraping is difficult. You can go for hair pluck. So at the root, you can see your dermatitis attached to the root. And also in case of fungal disorders, you can see the spores. If you stain under the lactophenol cotton blue stain, you can see the spores. And also when it is important, you can cycle, the hair cycle, whether it is in the telogen phase or anagen state. Even the breed specific, you have to see when coccus penis, whether it is telogen phase is more common. In endocrine disorders, telogen phase is more common. When there is going to be an alopecia or complete hair fall, you have to see the staging of the hair. And whether if it's self grouping is there, over self grouping in cats, it can have a broken hair shaft. Broken tip is like when it licks, the tip will be broken, but the complete hair will be broken when there is going to be psychogenic hair loss. That is called high psychogenic, when it goes keep on licking, repetitive behavior. Then wood slump examination, it is mainly for microsporum scanes identification. Swab for culture, when you do all this pyoderma, when you see a pyoderma lesion or there is going to be any scalings or moist wound, you can go for swab culture, both fungal and bacterial. Then fine needle aspiration. So then nodules are there. The nodule can be either a tumor nodule or this one fungal nodule. So you can go for aspiration, fine needle aspiration cytology. And last one is your skin punch biopsy, when there is going to be a non-healing ulcers, non-healing erythema lesions, skin is thickened. You can go for punch biopsy to see whether there is hyperkeratosis or parakeratosis or orthokeratosis. Then you can see all these inflammatory reactions, or any skin. This one, in case of a non-healing ulcer, your this one tumors can be present. So you can, with the skin punch biopsy, you can make a definitive diagnosis. And there are certain autoimmune disorders we can prove only by biopsy or histopathology. Other mere with the signs we can tell, but with the punch biopsy, you can accurately tell this dog is having this type of autoimmune disorder. Then comes the rule out common causes. So we know a dog or a cat can have flea allergic dermatitis. Sorry, flea allergic dermatitis. That is like it is allergic to the flea saliva. So you can give, it can be year around, like many cats are there present in the area, so the dog can be affected, or the cat itself is allergic to flea saliva. So you can have to go for a routine flea allergy treatment. So once you, this is mainly like response. What you rule out common causes is mainly you see the response. When you give some medication, you see the response, then you rule out the disease, whether it is because of that, the pruritus is because of flea allergy or not. So once you give flea treatment, the animal is okay, so it is flea allergy. If it is not okay, you go to the next step, you check for food allergy. So food allergy, it goes for many weeks. 8 to 12 weeks, you have to go restrict the normal food or proteins which have been given to the animal, go for novel proteins and new high carbohydrate, one protein, one carbohydrate, or else you can go for commercial diet, check out if pruritus has settled, or go for probiotic challenge. That is, you have to re-challenge with the normal food it has already been given. If there is a pruritus have not settled down, the condition is worsening, then you go for this one, atopy confirmation. So atopy, either if you rule out all these diseases, you can tell atopy, or you can go for intradermal test. So the major categories, coming back to facial dermatitis. So I have categorized under 6 headings. So major categories are parasitic dermatitis, bacterial dermatitis, fungal dermatitis, allergic dermatitis, autoimmune and immune-mediated dermatitis, and the others. I have brought in lots of diseases under others. So first one is the parasitic disorders, our very own canine dermatosis. So this is a very common disorder we usually see in a day-to-day practice. We know that there are lots of species of dermatitis, so we just take it as dermatitis canis. So the dermatitis canis can occur in both juvenile patients or adult onset can be present. So both the young dog or the old age dog. But if it is going to be an old age dog, it is an immunocompromised animal, or it is having a secondary endocrine disorder. So you have to keep in mind that this animal is not good. So that is why it is having a dermatitis infection. Also, when you are going to use iatrogenic Cushing syndrome, iatrogenic is like because of we doctors giving lots of steroid. Because of that also we can create a disease. So because of that also your this one dermatosis can occur. So the main thing is pattern recognition. How we are going to recognize the pattern in dermatosis. So dermatosis is a, you know, the name is a red mange. So it causes pustular lesions. So initially there will be a small lesion on the face. So the distribution for any disorders or any dermatological disorder, you please read about the distribution of the lesion, where and all it is present. Though we are talking about facial dermatitis, a dermatosis can occur in a localized form or focal form or a generalized form. So when the distribution of lesion is usually around the periocular, perioral, forelimb and hind limb, and also throughout the body, it can be present on the ventral aspect also. It can be first initially when it is going to be present as a focal dermatitis. It will be like a annual areas of erythema. Mild scaling can be present, and alopecia. As you see in the first photograph, you can see a very patchy alopecia. There is no reddening or erythema, just a patch of alopecia. Here, you can just see a mild hair loss around the periocular area. So you can suspect it could be a dermatophytosis also, but only when you do a scraping or hair pluck, you can see a dermatosis. So these are all very minute lesions you can see. But and also it can be red in color or hyperpigmented. Pigmentation can be occur. So it can be not always a red mange. Sometimes it can be in hyperpigmented state also. So you check for any erythema or papules or pustules or crust. Initially, it will be only papular eruptions. Once a secondary bacterial infection starts setting it goes for a pustular eruption, and throughout the body, it can affect. So these are the varieties of lesions I have displayed. So this is only on the forehead, and mild lesions you can see on the forelimbs. So here only the face, it is like so this like furunclosis like appearance has been produced because of the severe bacterial infection. Unless and until you set right the bacterial infection, this is not going to get cured. And also here the face and the same animal, the face and the chin area is, you should not mistake these things as some other disorders, which we'll be talking at the later stages. So you should just see the photographs, how the lesions are present. Similar lesions will be coming under autoimmune disorders also. So this part is like completely hyperpigmented. The skin will be velvety in appearance, and it will have a devoid of hair. You cannot see even a pustules. It will be smooth, thickened, and there will be black color, and sometimes and you people will think this is a hype because of a malassezia problem. But once you do a scraping, it is not malassezia, it is mainly a dermatosis. And also the people, this particular dog, they have given lots of medication, already been treated, but the main culprit is this. So they have given some steroid containing ointments. They kept on giving along with these medication, but they didn't give the oral medication. The owner have stopped the oral medication, given only these things, and it have led into a aggravated the condition. What comes as mainly in the face will spread to the other areas. These are the very severe form of dermatosis, where the secondary bacteria set in, and it goes for septicemia also. So the animal will be very dull. So this diagnosis is by deep scraping or hair pluck. And the feline dermatosis, the two species are there, cati and catoi. And dermatosis usually is not contagious to other animals, but in case of cats, this is contagious to other cats also. So here you can see the lesions are mainly on the face. So crusty lesions are present, and even on the ventral aspect of the body is affected. So anything like perithema papules in a cat, when it is fully affected, you just go for scraping. Usually we'll think dermatitis is very rare, so we will not go for scraping. We can go for any other mites, or it could be some allergic disorder. But you go do the scraping, you can see mites, but sometimes, most of the times, it will be confused with the other mite, like a feline scabies. So this is actually a case of feline dermatosis. So the treatment, we have lots of treatment options. You formulate based on the case. So for a focal lesion, you can go for shampoos like benzyl peroxide shampoos, like follicular flushing shampoos, amitraz dip, and lime sulfur dips. You can go with that, along with ivermectin tablets. You can go, or spot on selamectin, doramectin. These things you can go as a spot on. But when it is going to be a very severe or generalized pressure, you can go for all these flulaner, sarolaner, and Netsguard tablets, and along with the shampoos and supplementation of all omega fatty acids. You can go for, you just based on the case, you try to formulate a medication and give. So wherever it is necessary, you go for all these flulaner and sarolaner. Otherwise, you can stick on with the selamectin, spot on, and shampoos. The next one is the scabies. So scabies it is because of Scharcoptes scabiei, and it is zoonotic. So even owner can contract the disease from the animal. So we should handle it with care. So the distribution of this disease is mainly ear pinna. So ear margins will have a crusty lesions. Yellowish to gray crusty lesions will be present on the ear margins, and then elbow region and hock joint and the ventral aspect of the, in puppies and all ventral aspect, you will be thinking it is a pyoderma. And when you touch, it will be roughened thing. These are all classical signs of scabies in puppies. When it is our ventral aspect is very roughened, you just take a scraping and see whether it is dermatosis or scabies. The yellow crust, usually it will be restricted to ear margins and elbows. But sometimes, if it can be very severe, and it can be spread to throughout the body. In this dog, you can see the white, this one thick crust on the whole body. Here, everywhere in the body, it is present. So having an intense pruritus, even the ear margins are affected, and it had a mild bleeding from the ear margin. So this is the dog with scaly lesions on the ear tip and also on the face. So you can see the nasal planum is affected so much, it looks like some over hyperkeratotic, but actually it is a crust. So after treatment with all these ivermectins and shampoos, it like cured. Even the ear margin is like normal, back to normal, though it is like alopecia, but it is the crust have been removed. So in the next one is your feline scabies. So feline scabies is caused by Notarius cati. This is also zoonotic, and humans can have itching in the hand. They can have black spots like lesions on the hand. The clinical sign is mainly on the ear margin. So ear margin, and sometimes on the face also. So you can see a very thick region, crust can be present, scales can be present on there, and have an intense pruritus. The classical sign of a scabied animal, cat or dog, is a intense pruritus with crusty lesion. So here it is like less severe, only the ear margins are affected. Here it is a very thick. Here both and face and all is affected. So this is like classical feature of a notorious cat eye. Thumbprint impression can be seen on this sarcoptes, sorry, notorious cat eye. So here you can go for superficial skin scrapings and identify the mite. So treatment again here also you have lots of options like salamectin spot-ons, ivermectins, and you can go for fluralaner, sarolaner. So but the main thing is like you have to treat all the affected and all in contact dogs should be treated at the same time. So and also for secondary pyoderma you have to go for antibiotics, and also you have to discard all the this one cloth or any clean the cages and all the bowls, food bowls, everything should be cleaned thoroughly once you start treating the animals. So otoacariasis is nothing but it is caused by a otodectus cyanotis mite. It is highly contagious from one animal to another. So if a mother is having, our kittens is also will be having a this type of mite. So Persians are more commonly affected with otodectus cyanosis. Any portion you take, there will be lots of otodectus inside the ear. And here you can see a black waxy discharge in the ear. Black waxy discharge. This can be waxy or powdery in the form. Crusty exudate can come outside the ear pinna, not only in the ear canal, also in the outer side ear pinna can also, on the face, on the forehead. Also, we can see the lesions. When there is going to be so much of irritation, it will keep on scratching, and excoriations can also be seen around the faces and the head. So here it is like what we do is the ear swab examination. What we do is called as a ear swab examination. So this is the mite. So this photograph shows a cat with yeah, oral hematoma. Usually we see dogs with oral hematoma. This is a cat is having severe pruritus because of this otodectus cyanotus. So it was intense pruritus. It caused oral hematoma. So this is a case where the otoacariasis were, otodectus cyanosis was present on the facial region. They have a thick yellow crust on the entire face. It was present, but and inside, when we took the ear swab, it was positive for dermatitis. But when we took the scraping on the face, it was positive for otodectus. So it like what we should be present in the ear, it is present on the face, but dermatitis is present inside the ear. This is a post-treatment. We gave salamectin spot-ons monthly once for 3 months. So it got cured completely. So the treatment main thing is like you have to clean the ear canal. So any accumulated debris that takes out along with the eggs and the live mites, it will just clean out all the canal, and all the in contact animals should be uh, treated. So any otic treatments also can be used, and then systemically you can go for salamectin or ivermectin spot-ons. Then pediculosis. This is a common problem with mainly with the young ones like puppies. It can have lots of lysis on the face. So uh, it have lesions like miliary dermatitis. In case it looks like a miliary dermatitis, and lots of small papular eruptions on the body because since it bites, they have lots of lesions on the face. Sometimes it will be like asymptomatic, or this what your the lice will be present on the body without any lesion. You can see small lesions here, and all these nits and parasites are also present. Like salt and pepper appearance, it is having actually usually furmite. Linsocara radovoski will give a furmite, so salt and pepper appearance, but this fossil will be mostly on the dorsal aspect of the body. When it is on the head, it is actually nits of the lice. So you have to go for coat brushings or flea comb brushings. You can go for. And the treatment also, there are lots of options. You can go for powder, spray, spot-ons, dips, or lime sulfur, pyrethrin or pyrethrin propoxer powder you can use. And you can go for ivermectin and salacmectin, spot-ons, and fipronil for spray you can use. But the main thing is you have to clean the bedding materials and the grooming tools, what we use like a comb, and environmental cleaning is must. When we have a you think that it's like many animals are affected, you can go for collars. So the second category is a bacterial dermatitis. So pyoderma, we all know it is a general term, pyoderma. So usually pyoderma will be present as a secondary disorder to some other disorder, mainly your allergic dermatitis. So in pyoderma, your number of bacteria present, usually it is going to be staphylococcus. Infections will be staphylococcus aureus will be the usual infecting bacteria. Otherwise, like Escherichia coli, protease, and Pseudomonas species also can affect. So pyoderma is not only body, even the otitis inside the ear canal also it can occur. So the diagnosis is mainly by cytology and culture. You please, whenever you see a pyoderma, you go for ABST. ABST is must. Before you go for any oral antibiotic therapy, you check the ABST and then you give the medication. Don't give try out one medication, then try out another medication. First you go for ABST, check which is sensitive, more sensitive, give that medication and treat the case. And also if case of pyoderma, it goes for weeks together, like 4 weeks, or depending on the severity, you have to go. There are lots of medications I have listed out. Any standard books will give you all these medication, like first line drugs, what are the second line drugs. Usually we use cefpodoxime, cephaloxime tablets, and amoxicillin, and enrofloxacin also we are using in our general practice. So when there is going to be a severe pyoderma, you have to go for weeks together, like 4 weeks, 8 weeks, depending on the severity. You have to go for oral medication. So in pyoderma itself, there are few varieties. So what we are seeing is the pyotraumatic folliculitis or furunculosis. Any allergic condition or hotspot because of the flea allergic dermatitis, you can see such type of lesion on the anywhere, mainly on the dorsum of the body, or the head and neck area. So it is like a thickened plaque-like lesion can be seen. There will be pustules. Here you can see a thickened pustular area, like a scab, it is like present. So if you're going to take a cytology, you try, if it is west, you take. Otherwise, you just pull out a little bit, and underneath the area, you have to take a swab. These can be formed by self trauma. When it's going to be present on the head and the face, it is usually because of scratching. When it's going to be on the dorsum or the backside, it is like self trauma because of excessive biting, because of pruritus. So if you see a pyotraumatic folliculitis and furunculosis, go for ABST and give the medication. But along with that, you check out why it is occurring. Maybe sometimes it could be a primary cause also, because of a small trauma. It keeps on scratching, and self-induced self-trauma can induced bacterial infection can be present, or otherwise because of some other underlying lesion. Because of that, secondary pyoderma can occur. So this is a facial fold dermatitis, also called as a intertrigo. So this is mainly a conformational disorders. That is because of the breed. These breeds have many folds and wrinkles, so it helps in the bacteria or fungi to settle in that area and grows. It forms a humid environment for the bacteria to grow. So all the saliva particles can go and settle there. So usually the lesion is non-painful or non-pruritic. It can, but once it is affected with bacteria, it can have a severe. So this is a non-pruritic, non-painful area. You can see this dog had no pruritus, but while this dog, you can see pustules and crust present in this area. This have a severe itching. So when you leave, it is going to have a self-trauma lesions, and excoriation is going to be present. So cytology, simple direct impression cytology, you can see bacteria and lots of neutrophils in that area. When it's going to be a pyoderma, you can see a lot of neutrophils and bacteria. So you can go for either oral or topical antibacterial therapy. And also, since it is going to be like a this one fold, you can use cleansing wipes. This antibiotic cleansing wipes you can use regularly to keep the area clean. So this is the other one called as a muscle folliculitis and furunculosis, and also it is called as a chin acne or chin pyoderma. This is usually because of the trauma and secondary trauma, in the sense when it is going to have any feed, that the plastic bowls can give a scratch, or it is going to play with the toys that can have a scratch, mild scratch in that area. So that area can form due to itching. It can scratch that area, keep on rubbing on rough surfaces because of itching. So that time it can develop pyoderma type of infection. Mainly this is seen in boxers, Dobermans, Great Danes, and Mastiff, English Bulldog, where the lots of fold is present. Mastiff also folds, and drooling of saliva also can see in such type of animals. So it causes deep folliculitis and cellulitis. You can see um, a severe folliculitis in this area. You can go for topical, or based on the severity, you can go for topical antibiotics, and along with shampoos and systemic antibiotics for 4 weeks. You can go for such type of lesions. So this is one yet another type of bioderma called the mucocutaneous pyoderma, where only the mucocutaneous areas are affected, especially the lips and the commissures. So the commissures of the lips will be affected, and you can see all these pyoderma lesions. This is actually idiopathic, maybe because of slight trauma also it can occur, only the mucous membrane. In a advanced stage, it can occur throughout like vulval area, pads, or like your foot pads also can be occur. First, initially it will be a spot, like pustules can be, slowly can go for crusting, fissuring, and erosions. Erosion mainly is because of the itching. So I can go for topical or systemic oral therapy. So otitis, as in when the cases we are discussing, we can see otitis. Here we are seeing a picture of a bacterial otitis. Mainly this is present in a food allergic dog. So it have a severe pruritus. The first lesion is called as, first is a ear scratching on head tilting. So that can be a bacterial infection in the ear. So it can have a pus discharge, a foul smelling discharge, greenish color discharge, or brown color hemorrhagic. It can be present in many types. And if it is going to be having a severe itching, it can lead to a oral hematoma. So mainly these are all present in other disorders. Along with other disorders, this otitis is present. So next category is your yeast and fungal dermatitis. So the first one is your Malassezia dermatitis, very common in your practice, Malassezia patchy dermatitis. So here it is like yeast infection. So this yeast infection loves a humid environment. So being in a tropical and humid climate, we having many cases of Malassezia. It can be either primary, which is a less number of cases are primary cases, but no more number of cases are because of the secondary infection. So secondary and underlying primary lesions could be a allergic disorder. So when there is going to be a skin barrier affection, these Malassezia can grow and it can prevail. So it can form a disease condition in a dog. So it will have a moderate or intense pruritus. So the area is like around the oral cavity, around the periocular area. Ears can be, ear pinal can be affected, and also on the ventral aspect of the neck, axilla, groin, and on the paw pads also will be affected. So there will be scalings, generalized alopecia, mainly seborrhea will be there. Lots of like seborrheic acid, oleosa can be present, and also erythema. Sometimes the animal will be pinkish in color, but in a chronic case, it will become hyperpigmented, lichenified, and hyperkeratotic. The thick skin lesions can be seen. So it's like primary disorders can be mainly atopy and food allergy. Mainly atopy is the disorder where you can see Malassezia very predominantly. So cytology, you can go for tape impression, and these are the peanut type shaped yeast organisms you can see in a blue color. So you can see a thickened hyperpigmented areas. Here only the periocular and oral cavity, the muscle area is affected. You can see a hyperpigmented area, but this is a thickened skin. So in a dog, in the ear pin also, it will be looking as a raised lesions, like hyperpigmented. Along with that, you can see a erythematous lesion. When you take a tape impression, you can see lots of Malassezia. So this is a Malassezia infection in cat. Of course, even your cat can get Malassezia infection, mainly on the neck area. And this is a ear with Malassezia thickened and hyperpigmented lesion can be seen. So the next common fungal infection is the dermatophytosis, either by Microsporum canis or Microsporum gypsum or Trichophyton. The first one what we are going to see is the Microsporum canis. So Microsporum canis will be present in the hair shaft near the root. So there will be brittle hairs, breakage of hairs, hair stubs will be seen. So there will be follicular plugging, and there will be like round circular alopecia will be present with thick scabs or crust also will be present, mainly on the face near the muscles and the forehead, and also on the foot pads on the tail region. You can, on the ventral aspect, you can see lots of. So if you want to view a microsporum canis, whether it is positive or negative, you have to use a good quality wood slab. So you can see the greenish fluorescence, apple green fluorescence in the affected area. So this is the affected area. The stubs are stub of the hair. Not the complete area should not be in green color. Only the hair should be in green in color. If it is the complete area or any scales or crust is giving such fluorescence, it is a false negative, false positive lesion. So only the hair should be fluorescing, giving the fluorescence. Then you can go for skin scraping. With that skin scraping, you can go for culture and PCR and biopsy when it's going to be a chorion, called the chorion, like a fungal nodules or granulomas. It's called a chorion. There you can go for biopsy and check out the fungal spores and hyphae. So this is a cat with Mycosporum canis. We can see the greenish fluorescence on the hair alone, not on the entire body, hair alone. And any topical applications like ointments or solutions can or creams can give a shade. Any purplish shade or orange shade or yellow shade and also green shade is false positive. You should not take that as a positive thing. Only if it is going to be a greenish color, apple green fluorescence, and that too in the hair stub, then it is positive for microsporum canis. Usually we'll tell only 50% of the cases gives fluorescence, and other the 50% will be cases will be negative for negative in wood slump. But it's not like so. In the recent studies, like a good quality wood slump will 99% it will tell it whether it is animal is having a lesion or sorry condition or not. So this cat is after treatment. You can see the full hair growth. Nearly it took 4 months, 4 to 5 months to for the hair growth. So this is the dermatophytosis because of trichophyton mentocrophytes. You can see a circular lesion. So a centrally healing lesion with raised edges on the circle area. You can see circular alopecia, erythemas, like ringworms. Usually humans get right ringworms like that. The ringworms of dogs. So you can have a pruritic lesion, broken hair will be there, alopecia will be there, erythema crusting will be there. So again, wood slump, it is this trichophyton will give a negative result. You have to go for culture, PCR, and biopsy. So treatment options, you can go for mild lesions, you can go for topical therapy, sprays, shampoos and sprays you can go, and lime sulfur dip, N-proconazole dip you can go. If it is going to be a severe form of disorder, for malassezia, you can opt for ketoconazole and terbinafine. If it is a microsporum canis or trichophyton, you can go for itraconazole and also pulse therapy. That is 1 week off, 1 week on. Like that, you can go altering week. You can go for itraconazole pulse therapy, especially in your cats. Ketoconazole mainly will give in dogs, that too in malassezia. Terbinafine can be given in both dog and cat, which is having severe malassezia. So the next comes the major part is the allergic dermatitis. So the first one is your cutaneous adverse food reaction. So the main problem is because of the allergens in the food. So anything can be allergic to a dog from a food, can be a dairy product or wheat gluten or non-veg items like proteins, like meat proteins, or also commercial diet can be allergic, and even the snacks and treats can also be, and nut items, especially cashews, all this can be allergic. So you have to, the first sign will be the distribution is mainly on ears, around the perioral area, and this one throughout the body and on the paws. So the main area is ears, perioral area, and the paws. So first symptom the owner tells is the head shaking is there, scratching of hair is there, rubbing of face on the inanimate object is there, frequent licking of paws. It keeps a paws like this and it keeps on licking. So these are the classical symptoms of food allergy before other symptoms like papular eruptions and pyodema, where you can see circular, like a moth-eaten appearance, where it is common in bacterial folliculitis and demodicosis. Here it is a bacterial folliculitis. You can see lesion. Initially, there will be papular eruption. When you in an angle, you can see like a bumpy appearance of the body. Other than that, there will be no other symptoms. Only itching will be there, ear itching and paw licking. Slowly, the ear will become pink, like erythema will start in. Then the paws will be like erythema. Then your all these papular eruptions will go for pustular eruptions, and they break out all these epidermal colloids. All these things will start coming in, and slowly hair fall will be present. And also, in some dogs, you can very well, the owner will very well tell there is gastrointestinal signs like vomiting, diarrhea, dyspepsia. Once I give this food, it is having gastrointestinal lesion and skin lesions. So here, recurrent pyoderma and malassezia dermatitis is also present. Here also, like atopy, when the condition goes for chronic period, the axilla and the groin area is also affected. So you have to make sure whether you have to differentiate whether it is food allergy or atopy by in a chronic form. You have to, because all these are like look-alike disorders. Your fee allergic disorder, your cutaneous adverse food allergy, and your atopy are all look-alike. So you have to go for dietary trial and then only confirm whether it is food allergy or atopy. So you have to go for hypoallergenic diet trial, which spans for weeks of 8 to 12 weeks. So you have to stop all the regular diets and go for one protein and one normal protein. You can go for such type of food. Uh, Ask the owner to strictly follow the diet, and after you will be seeing a improvement. If it is a food allergy, like after 8 weeks, like that, you can see a improvement. After 10, like 12 weeks or 10 weeks, you can go for re-challenging the previous diet. You can give, you check for any lesion, whether new lesions are developing, itching is developing. If at all it is developing, the lesion is because of the previous food. If there is no lesion and pruritus, like sorry when there is going to be a itching, when the food is given, it is because of the food. If there is no improvement on the pruritus at all, when you give even on the dietary modification, it means that is it because of some other allergic condition like atopy. So the treatment is mainly dietary modification, whether homemade or commercial diet like a hypoallergenic diet or analgesic diet. You can go for for recurring superficial pyoderma. You have to go for ABST, then give antimicrobial therapy along with your supplements, shampoos and skin strengthening supplements like omega fatty acids. You have to go for all these treatments. So this is a cat with food allergy. So lesion you can see on the foot. So the head and neck pruritus is mainly present in the food allergy and your atopic dermatitis. So in a cat, flea allergic dermatitis is more common than the food allergy, and the food allergy is more common than the atopy, in especially in cats. But in dogs, almost all many dogs are having atopy and food allergy. So you can see hair fall, erythema, thickening on the ear, pinna. So you will be thinking this is AXA notoris catae, feline scabies, or any otodectus, but it's actually you have to go for check out all the diagnostic tests. Then you have to tell whether it is a food allergy or not. So atopic dermatitis, so it is because of the environmental allergens. So by meaning or by telling it is an environmental allergen, it can anything can be a allergy. Even a flowering plants or perfumes or floor cleaners, anything can be a allergen. So the pruritus will be mainly on face, paws, and axillae. In food allergy, it is on mainly on the ear and paws and around the periocular area. Here, axillae is also combined. So main area is like a face and your paws and the axilla. So along with the chin also will be affected, and your groin area will be affected, and the anal area also will be affected. So cats will have a self-induced alopecia, miliary dermatitis, like papular eruption will be, red dots will be seen on the head and neck, nearly near the forehead and all the neck area. You can see miliary dermatitis. And here eosinophilic granuloma, which I'll be telling in the subsequent slide. So eosinophilic granuloma complex will be seen particularly in cats with atopic dermatitis, flea allergic dermatitis, and food allergic dermatitis. So there will also be secondary bacterial and yeast infection, more common with atopy in both dogs and cats. So diagnosis of exclusion, you have to exclude all other disorders, and then you have to go for flea control trial, elimination diet trial, then go for cytology bacteria, give medication. Then only you have to confirm whether it is atopy or not. And also you can go for allergy testing if it is feasible in your area. So this is a variety of lesions of atopy I have shown. So this is a mild atopy near the eyes and periocular area. You can see erythema. And here you can see a widespread, this will be confused for demodicosis. So you can see a nice erythematous lesion, like a circumscribed lesion you can see. And here pigmentation of the uh, yeah, around the periocular and nasal bridge. This will be confused with your autoimmune disorders. A healing autoimmune disorder will look like this. So you should be double sure whether it is under treatment or it is a new case to you. So you should ask the owners about the history. And this you can see thickened the skin, erythema is there, and also this is affected with both bacteria and fungal. Hyperpigmentation is there. Full ear pinna is affected, and you can also see lesions on the leg and underneath the neck. So here most of the eyes also in atopy dogs will have like blepharospasm. Some dogs will have. So maybe like immune system is triggered. So it is getting affected. Like your inside your eyes, iris also is getting that will be affected. So it will have a blepharospasm like photophobia. It will be having few cases. And here you can see erythema around the oral cavity and around the eyes. So this is a classical sign of an atopic dog. So wherein the ears are affected, like erythematous lesions can be seen, and in the axilla, which is the main sign for atopic dermatitis, along with the ventral neck, and here the groin regions, the scrotum also is affected. And you can see the erythema here on the leg region also. So it is basically the whole body has been affected, but it's not so severe because it has hair on the other body parts. So this is a cat with atopy. So after ruling out all the other parameters, we can suspect this as a atopy. So it is having a severe excoriations. It's like self-inflicted wound on the ear canal and all on the sides of the face. So it have so much irritation. It will keep on scratching, and there'll be lots of erosions and ulceration. So the main treatment is, the first treatment is removal of the allergen. You try to identify the allergen and remove the allergen from the remove the dog from the allergen, separate the dog from the allergen. Then targeted therapy. So the main aim is to reduce the pruritus. So you can go for, there are a number of medications like oclacitinib, cyclosporin, prednisolone. So initially, if it is going to have a severe irritation, you can go for prednisolone for a few days and then taper it. Then you can continuously give, because this is a long time therapy and it's going to be a lifelong therapy. So you have to go for oclacitinib and cyclosporin and lokivetmab. So you have to choose the treatment based on the severity of the animal. But the aim is to reduce the itching and have to make the animal like without any pruritus. Then also the important thing in this therapy is, main goal is like reduce the pruritus. Then the second one is like reduce the secondary infections, mainly your yeast and fungal infection. You have to go for topical and both sprays you can go. Then the main thing, the other main thing what you are going to do with in the therapy is a skin barrier repair. Here the barrier will be so much affected that it will allow the allergens to enter the body, and where the immune system will be triggered. So to stop that, you have to build the skin barrier, so or repair it. So there are certain ceramides and fatty acids which you can apply it as a serums. There are lots of serums like a face serums. You can have, and protecting hydration serums are there with hyaluronic acid. All these can be supplementary. The supplementation in a atopic dog is necessary. Not only with the targeted therapies will not achieve a good remission. Along with this supplementation, you have to treat the animal. Then if not at all it is responding to any other medications, then you have to go for specific immunotherapy if you know what kind of allergen is prevailing in your area. So they're going to be there. People have to take lots of research work for each area throughout India, in each area or each district, what type of allergen is present, which allergen can cause allergy to the dog. So we have to do a extensive research and find out what kind of allergens are present, and based on that, you have to formulate the specific immunotherapy. So this is a dog with canine atopic dermatitis. Probably this canine atopic dermatitis can maybe because of the house dust mite. So environmental allergens. Na? So environmental allergens can also, the house dust mite is the main one of the main allergen for a dog and both for humans also. So one such allergen is Dermatophagoides farinae and Blumia tropicalis. This dog came with a lesion on the oral cavity. You can see papular eruption, erythematous eruptions on the oral cavity alone, and there is a mild color change. So when we did a skin scraping, in the skin scraping itself, we could find the house dust mite called the Blumia tropicalis. There will be lots of filamentous will be present. So then we asked the owner to get the vacuumed house duster. So with the vacuum cleaner, you can get the fine dust particles. He bought that, and in that we saw Dermatophagoides farinae. So this house that maybe we know that atopy is a genetic disorder. So it could house dust mite can act as a flare agent. So whenever the animal is exposed to house dust mite, it can trigger the immune system and can get already present atopy will be the lesions will be aggravated. So whenever it is coming in contact with the house dust mite, it is going to have aggravation of the lesions. So the treatment initial dietary trial, they have been treated outside. They told that dietary trial is there is no response. So we went for ocloserintib tablets for 14 days and once daily for a month. Then along with essential fatty acids, then benzyl benzoate lotion. Since it is a mite, we wanted to be double sure that it is also getting killed. So we gave benzyl benzoate and acaricide. Then repair of skin barrier, we got phytospignosin spot-ons weekly for 4 weeks and every reviewed for weeks. So you can see the reduction in the signs post-treatment. So but it is on the cyclosporin for like a past two years. It is on the cyclosporin. So next one is the immune mediator is like insect bite allergy. Any immune reaction will be triggered with the insect bite. In the sense it can be either mosquitoes or fleas or flies or ants can be present. So mosquito bite allergy is most common in cats. Any mosquito bite sensitized cat can have such flare-ups when the mosquito season has come. So when it can have a intense pruritus, papules crust erythema, mainly on the nasal region. So you can see spots here, erythematous spots. And also the ears will be affected and the foot pads underneath the foot pads or the side of the foot pads, you can see red spots like lesions will be present. So how the mosquito biting area and that has uh, induced a lesion. So you can see intense pruritus. The like these things like any ant bite, you can see such type of facial swelling. But in cats, there won't be any facial swelling. But there here the nasal planum and the nasal muscle will be little bit enlarged and with a lot of erythematous patches. So based on the history and lesion distribution, you can suspect whether it is an insect bite allergy or flea bite allergy. So based on that, you can go for chlorpheniramine and prednisolone or ocloserintib for to reduce the pruritus and inflammation. In case of fleas, you can go for flea therapy, anti-flea therapy. So the next thing is autoimmune and immune-mediated dermatitis. So the first one is a canine juvenile cellulitis. It's called as such a juvenile pyoderma puppy strangles or puppy strangles. So it is a idiopathic reason. We don't know why the immune system is triggered. So it occurs from the age of 3 weeks to 4 months of age. Any Dachshunds, golden retrievers, then Labradors are most commonly affected. So here the lesions will be mainly seen on the periocular area, perioral area, and on the nostrils and ear, inside the ear pinna. And along with that, what you see is like lymphadenopathy. So a submandibular edema, lymph node will be enlarged and all the popliteals will be enlarged. And in a severe disease condition, your animal will be dull, lethargic, and depressed in depressed state. So the first one is your pustular lesions. So this is the main thing is since it's a pyoderma, but it will not have, it is a sterile pyoderma. So only if it is being affected with the secondary bacteria, you can see bacteria. Otherwise, it is a sterile pyoderma. Pustules will be present. You can see with the cytology, with the help of cytology, you can see lots of neutrophils. So the treatment option here is you have to suppress the immune system. So you have to go for prednisolone. So higher dosage of prednisolone should be used. So every 24 hours and afterwards you have to taper unlit resource. It usually take around 3 to 4 weeks to get cured. So this is another form with a severe lesion. So this at least is a okay, somewhat okay, like lesions on the face, scabby lesions like thing are present. But here it is more of a like moist wound, and here canal is completely affected. So in this dog, we have to go for systemic treatment also, like fluid therapy, because of the oral lesions or like around the oral cavity, it will not eat. So it have to go for other treatment along with prednisolone treatment. So this is an important disease like pemphigus foliaceus. This is one of the important disorders in dogs. So there are different types of autoimmune disorders in both cats and dogs. Well, mainly we'll talk about the dogs now. So there are number of like not number of disorders. There are around like 8 or 6 disorders. Like pemphigus, there are 3 types. There are pemphigus erythematosus, pemphigus foliaceus, and pemphigus vulgaris. In that, pemphigus foliaceus is most common. So what happens here? The the keratinocytes are attached together. So the attaching proteins are affected. The autoantibodies are produced against the whatever proteins it helps for additions of the keratinocytes. So this foliaceous is, we know there are several layers in the epidermis and dermis level. So it is a superficial affection. So the pemphigus foliaceus will affect on the superficial area. So the lesions are mainly, the distribution of lesion is nasal planum around the eye, ears, and paws. The same lesion you can see for other types of autoimmune disorders also. But how to conclude or confirm which type of disorders is like, you have to go only with a biopsy, you can tell. So pemphigus erythematosus is like a benign form of pemphigus foliaceus. So it will have a lesions around the eye and nostril, but foot lesions will not be seen. So only around the eyes, the facial lesions are seen, but it's not very rare. Only the topmost layer epidermis is affected. Likewise, pemphigus foliaceus, your epidermis is affected, but a little bit deep. Per layers, you can see subcorneal pustules can be seen on this one. What is it? HP. Acantholytic cells will be seen on the. So it is a classic sign. Acantholytic cells, if you see in a HP, then you can tell it is a pemphigus foliaceus, but still many other chronic diseases like atopic can also show acantholytic cells. So you have to be see the distribution of lesion, nature of the lesion. Then with the HP, you have to tell whether it is autoimmune disorder. So vulgaris is more deeper. So it goes for deeper layers of epidermal layer, the dermis. So it have a more severe lesion, and it is like a completely very severe than the what you see in the foliaceous, and throughout the body also you can have severe erythematous lesions you can see. So in coming back to foliaceous, what you see on the lesion area is erosions and alopecia. Initially there will be erythema, alopecia, then the due for erosion of the area, and there will be, in the first picture you can see swelling of the nasal planum, and you can see in this dog the other area parts of the body is completely normal. So the lesion is restricted to the face, and but also the ears and paws can be affected, and any time other body parts also can be affected in the foliaceous, and it is on the epidermal layer. We have more severe form of autoimmune disorders, which we have not discussed yet, but I will tell what are the disorders, like bullous pemphigoid, then you have erythema multiforme, then Steven Johnson syndrome, then toxic epidermal necrolysis. So all these things will affect the deeper layers of the skin, the dermis, or the basement membrane. So the basement detachment will be seen. There are lots of pustular lesions will be present, and through it will be most of the like systemic lupus erythematosus, discoid lupus erythematosus. Discoid lupus erythematosus is a benign form of SLE. So there also the lesions will be present on the face, but in SLE you can see the oral cavity lesions. Pemphigus oral cavity lesions will not be present, but in other autoimmune disorders you can go for systemic signs, and oral lesions can be saw, and all those other things are very severe, and detachment of the basement membrane will be present, and ulcerative lesions will be present. These are all erosive lesions. But in other autoimmune disorders, there are ulcerative lesions will be seen. And erythema multiforme, you can see punctate ulcer-like lesions on the mainly on the ventral aspect. It will be seen like a target cell appearance, like a round in between the area will be depressed, and the other outer area will be reddish in color. So what you're going to do for pemphigus foliaceus is you have to suppress the immune system. So we can go for prednisolone for immediate reduction. Then you can go for long-term therapy with azathioprine or cyclosporin or oclacitinib. And again, tacrolimus, like a calcineurin inhibitors, ointments also can be applied for severe lesion. But if it is going to be very severe, sorry, very less severe cases, you can go for tacrolimus ointment. But severe lesions, you can go for other oral immunomodulators. So this is a pemphigus foliaceus with throughout. You can see throughout the body. You can see crusty lesions, and this is the dog before and after therapy. So eosinophilic granuloma, as I said, is because of the hypersensitivity, because flea bite, foot, and atopy. You can see raised plaques, papillary nodules, or erythema and alopecia. This is a severe form of eosinophilic granuloma. Granuloma mostly will be present in the lower lip or upper lip. So the treatment is identification of the allergen identification, and you can go for systemic antibiotics. Then in case of cats, you can go for methylprednisolone, acetate or prednisolone. Alternatively, we can go for triamcinolone or dexamethasone. And any refractory cases, you can go for doxycycline along with niacinamide or cyclosporin. So this is vasculitis is another condition, immune-mediated condition where the blood vessels are affected. So here your punctate ulcers or necrosis or purpura of the ear tip will be seen, and also sometimes ribs and oral cavity or mucus or foot pads can also be seen. Here you have to go for biopsy. The treatment options are prednisolone, pentoxifylline to suppress the immune suppression, and to maintain the blood vessel wall integrity, you have to go for pentoxifylline, and calcineurin inhibitor ointments can go. And along with that, immunomodulators like doxycycline and niacinamide and antioxidant vitamin E can be given. In any refractory cases, you can go for cyclosporin or oclacitinib. So this is one canine dermatological syndrome. So it is an immune-mediated disorder which autoantibodies are targeting the melanocytes. So you can see here, pan uveitis. The first lesion will be the eyes will be affected. Uveitis and corneal opacity you can see. Then slowly it will affect the nasal planum. Erythema will be there, and leukoderma and leukotrachea will be there. Nasal arteritis also can be seen. Here the nasal planum in between can be affected. So the distribution of lesion is mainly on the face, and vulva and foot pads also can be affected. The main diagnosis is biopsy. Here also we'll go for immunosuppressive drugs along with life. It is actually a lifelong therapy. So alopecia areata is like a hair protein. The protein of the hair will be affected. So it will be complete hair loss on the face, especially on the face. So there is no treatment. It is a cosmetic disease of a dog. There is no treatment. The last one is the other dermatitis. So zinc responsive dermatitis is actually there will be less zinc in the body circulation, or it is not deficiency of zinc. Maybe it is not able to absorb the zinc from the food, or it is not. It is a genetic disorder. So the main lesions are on the face, like parakeratotic lesions will be present, erythema will be present mainly on the mucocutaneous junction, scrotum and distal extremities. So there will be lots of scaling and crusting and lichenification can be seen, but it is mainly symmetrical. So in biopsy, you can see a parakeratotic hyperkeratosis. So you have to give zinc supplementation. So vitiligo is a immune-mediated disorder. So here is a very rare disorder. So hereditary, you can see in Rottweilers and Doberman Pinscher, that your leukoderma, poliosis, all will be seen around the eye and the nasal region. So you have to differentiate. That is also called as a nasal hypopigmentation. Either it can be a congenital disorder, which can be seen in Labradors, or it can be a seasonal or cyclic. It can also be seen in a Labradors. Again, the seasonal. During winter season, it was called as a snow nose or winter nose. Once the summer comes, that normal pigmentation will be present. And in the nasal hypopigmentation in the congenital form, by birth it will be flesh colored. Here it is white in color. So nasal hypokeratosis is there is be this is also hereditary in generally in Labradors, and also this is common in brachycephalic breeds where the normal wear and tear with the keratin will be rubbed off. But in a phase with a dog with a face like pugs and botses, it will not be able to. It will not touch the ground or bowl. So it will not the normal wear and tear will not be present. So here there will be a adherent keratinous substance. There will be proliferation of keratin substance mainly on the nasal region. Frond-like projections will be present. So how you will be treating it is like you can trim the fronds, then you can go for like anti seborrheic agents like a salicylic acid, urea gel, and lactate gel. You can go, or vitamin A analog tretinoin gel can be used. You have to wet that area, try to use the anti seborrheic agent, then you can go for tretinoin gel, that's the acne gel. Then hypothyroidism, we know pretty well what is hypothyroidism and how it is caused. So here the lesion, two lesions can be seen in the face. One is the nasal bridge alopecia and myxedema of the face, which gives a tragic expression of the uh, dog. And there's the nasal, this one, what alopecia. And the treatment is levothyroxine. So actinic dermatitis or solar dermatitis is because of the sun. So sun will be affecting the uh, lightly pigmented or non-pigmented areas, mainly on the muscle and around the eyes. You can see like crusty lesions or erythema. Scarring can be present on the other body surface, mainly on the dorsum. And this is mainly with the history and biopsy. So the first line of treatment is to avoid the exposure to sun. Use some sunblocks or sunscreen, and along with that, you can go for vitamin A preparation or isotretinoin tablets or prednisolone to reduce the itching and erythema. And prognosis is like mild lesion, it heals. Otherwise, it will lead to squamous cell carcinoma. So this is a case of sunburn, but it's not an actinic dermatitis. It's sunburn. Blisters were formed, and gradually with the this one healing wound healing ointments and spray that has by 30th day it has this is a severe form of sunburn and it healed by 30th day. So neoplastics, there are a number of neoplastic disorders like histiocytoma, transmedullary tumor, and mast cell tumor, squamous cell tumor, plasma cell tumor. All these things are not only found in the body, but also can be present as an extension of from the generalized form. So iatrogenic hyperhidrocortism is mainly because of the external application of your uh, steroid ointment. So it can fall the localized where you apply, there will be alopecia. This is the castrosis cutis because of the steroid application for more than 6 months. So curling of ear tips will be seen in cats. Otherwise, comedones and bruising of skin will be seen. So this is based on history and science, and the treatment is mainly avoid the cream which has been applied, and also you give time for the natural curing, and along with that you can go for vitamin analog like isotretinoin capsules. So this is a cat with, you can see the alopecic area and pendulous abdomen, distended abdomen in a cat with iatrogenic Cushing syndrome. So feline acne, it is again a deficit disorder of follicular keratinization. So keratin plugs and like comedones like structures will be present on the chin area, lower lip, and it can be present both in a papular form or the comedone form. For comedone form, you have to apply anti-seborrheic agents or gels. For papular form, you have to go for uh, secondary bacterial infection medicines, tretinoin gel, and benzyl peroxide gel and mupirocin gel, and along with the antibiotic gels. So idiopathic facial dermatitis, one of the emerging disorders or in cats. This is because of there's unclear, the cause is unclear. You can see a symmetrical blacky crust or dark discharge around the periocular and nasal planum area. This may progress to, usually it is non-pruritic, but only thing it is a discomfort to the owner, like the animal is looking a dirty face syndrome, because the dirty face syndrome. But the point is you have to check out whether the animal is not having any other autoimmune disorder or allergic disorder, and also you have to check the nasolacrimal duct blockage, nasal lacrimal duct blockage. So because of that also maybe there could be tear secretion, lots of tear secretion. So rule out all this. If there is no other reason, only that black secretion without any pruritic lesion, this is definitely a facial dermatitis, mainly seen in Persian cats. These type of animals, how we are going to treat is like you treat for secondary infection if there is going to be any pruritus or edema. Otherwise, just wipe the area frequently. Pruritus controlled with prednisolones or other medication like antihistamines can be. But general principle is do not breed the male or female cat to produce kittens. So this is another one, feline idiopathic ulcerative dermatitis. All these reasons is a behavioral disorder because of the excessive scratching, maybe anxiety or social stress or aggravating factors are not known. What is the aggravating factor? It keeps on scratching. You have to mainly seen on the neck and in the shoulder blade. So this is a lesion erosion or because of the furmite. So you have to you can compare and or you can tell this is more severe form of ulceration. This is actually a erosion. So you have to find out what is then you have to got like behavioral modification drugs and or like mild sedative drugs like topiramate can be given, gabapentin can be given, and along with that steroid therapy can also be given for the inflammation. So take home message, if there is going to be any facial dermatology, dermatitis, the etiology is very varied. Try to study what are primary lesions, secondary lesions, and both primary and secondary mixed lesion. Try to identify in each case what type of pattern is present. Do a thorough diagnostic workup. Please don't leave any test. In any all the cases, you do all the tests and find out and give a appropriate treatment. Don't give unnecessary medication. You give appropriate and you decide what can be given for if a localized lesion, this medication. Severe limb lesion, this medication you can give. If it is a pyoderma, I will go for ABST. If it is a fungal, I will go for culture and then treat the animal. So I take this moment to thank Dr. Nagarajan sir and VetPro Drools for giving me an opportunity to give a webinar talk. Thank you so much, sir.
Thank you, Dr. Sandhya, for this insightful and practical session. It's time for our interactive QA sessions. If you have any questions for Dr. Sandhya or to the IAVD team, please drop them in the chat box. Please drop the questions in the chat box. We will address to that. There is one question now. Discuss the role of omega-6 in dermatology.
Yeah, the essential fatty acids, omega-6, 3 or 9 is essential because it is for the building of the skin barrier. So it will generally maintain the skin condition. So any disorders, you try to give all omega-3, 6 and 9. You have lots of syrups form. And also like apart from that, other fatty acids and lipids also can be supplementation. So you can give a separate webinar on nutraceuticals in dermatology. So there are a number of medications are there. You can go for such time. This is mainly for the skin barrier function.
Is there any approved laboratories to test the skin
As far
allergens
as
in dogs?
as far as I know, I don't think so. We have for animals, but for humans there are laboratories for allergen testing. So the cost is very high, and the allergens are that they have done a research and they have a separate set of allergens. What could be the probable allergen, but we don't have such type of list in hand. Nagraj sir has done previously with what type plants like 16 plants they have identified. Apart from that, there are no other researchers. So we need to first find out, then standardize, then we can maybe start a laboratory to find a allergen.
The role of vitamin A, D, and E is there.
Yeah, same. Vitamin A it will be helpful for this collagenization and epithelialization of skin. And D is also helpful in the same for skin barrier function. It will be helpful, especially in atopic dogs. You can give all these medication, allergic dermatitis, and E is an antioxidant. Very oxidative stress near at the The sir wants to talk, I think so. Ma'am, sir wants to talk.
Yeah.
Not that, sir.
Good. Yeah. Okay. You carry on. Just
So vitamin E is an antioxidative property. All these things can be given in both an autoimmune disorder and immune-mediated disorders. So which fluorescent lamp you approved or called as a glut fluorescent lamp? You have to check out which company is giving. So you check out like a positive, a positive case, untreated case. You can check out with the lamp whether it is showing positive result or not. So by that you can tell whether it is a good lamp or not. The urea gel usually give like hyperkeratosis in the elbow region and paw region. So you can go for lactate gel on the face or salicylic based or sulfur based gel on for the hyperkeratosis. If the dermatitis is primarily bacterial or parasitic and is now secondly invaded by fungus, what should we treat first? So you should treat altogether. So parasitic, you
you can.
can go.
We have got lot of topical therapies, so better to go for, because always we have fully loaded with the topical shampoos, topical sprays available in the market. We can very well go for treating them with treating the secondary microbes with the antifungal and antiseptic sprays, shampoo, lotion, wipes, everything is available. You can use according to the need of the animal and according to the cost and what is the preference of the owner. All those things you have to remember and do that. As doctor was telling, we have to work out on individual state. We have to work out on allergic dermatitis. What are all the allergens which are prevailing in the specific area? Very soon we are going to have some pan-India work by our team, IAVD. We'll be doing it, and very soon we'll be getting the list of allergens which are prevailing, top 10 allergens or top 15 allergens in India. That we'll be doing very soon. Within few years, we'll be giving the report. Then we can very well go for identifying those allergens, and you can go for immunotherapy or even going for intradermal test, identify what are all the allergens in your area, particularly that animal is having. Individually, it will vary. So we have to do and identify that allergen and go for specific immunotherapy. So that is the best way to solve the problem. So initially you have to control the secondaries, then you have to go for identifying the flare factors. Then you have to go for treating the flare factors, and you have to treat the pruritus. If it is going to be acute, we can go for prednisolone and oclosutinib. If it is going to be chronic, we can go for cyclosporine, oclosutinib, Lokivet, MAP, all those things we can use. So this practice, she was clearly explaining about it. We can very well follow it up. If any problem, we are going to have a very great session on atopy and pyoderma in our Congress. I request everyone to come over there, and because it is going to be the author is the one who has given the guidelines in pyoderma, canine pyoderma. Annie Loeffler. She is going to come. She is the professor of dermatology in Royal Veterinary College. She was the one who has given the guidelines for canine pyoderma. That is how to use, what is the topical therapy, how best we can use, when to go for this thing, systemic antibiotic, and whether to go with which condition we can go for systemic and topical, which condition only topical, like that we can very well discuss about it in our Congress, and we are going to do that. And apart from that, what are all the type of therapy which are available for atopy, and also what are all the other options other than the regular routine therapy, what are all the other options which are available, like collagens, ceramides, and whatever hyaluronic acid, see all the proteins which are available, how to use it and make use of it in a nice way. Because it is a multimodal approach to solve the problem. Individually, the response will vary for individual drugs. So we have to approach in a different way. That is going to be discussed by our D. Bout. He is the one of the important person in atopic dermatitis research. So he is going to give the lecture on it. So please, all of you, make sure that you are going to attend the Congress, which is going to be a very great knowledge gaining Congress. Thank you.
There is one more question. How to do hypoallergenic diet trial? Is one question.
So we can go for dietary trial with the 8 weeks dietary trial, particularly the analogenic diet you have to give, because it is going to be less than 1 kilo delton. So we can very well go for analogenic diet for 8 weeks, or you have to go for a selective diet trial, or we can go for, because it is better to go for hypoallergenic, analogenic diet, because it is the 100% you can have a guarantee that it is not going to be a food allergy or it is going to have a food allergy. So we can very well identify the cause of the food allergy after reintroducing the old food one by one, each protein for every 2 weeks, and see the response, whether it is going for recurrence of symptoms and other thing. Accordingly, we can identify what is the culprit and we can avoid. So that is the thing. That is the way we have to do the dietary trial.
How can we handle owner compliance issues, especially when treatment is long and cosmetic recovery is slow?
So that is, we have to tell the owner prior, because people are going to face the problem throughout life. If it is going to be an atopy, we can tell like that. If it is going to be any genetical disorder, you have to tell like that, because they will be understanding the disease. First, you understand the disease and make them to understand. That is the thing. So once you are going to explain thoroughly, they'll be in a position to follow it up, and they can decide what type of treatment you can go for it like that. Because it is sometime it will be a costly treatment, so we have to follow it up for a long time or sometime throughout life.
How can we approach chronic acrylic dermatitis, that too in a hypothyroidism patient?
Hypothyroidism patient. Actually, this acrylic dermatitis, we have to identify whether it is related to psychological event with the allergic cause, or boredom chewing is due to any other reason. Suppose if the person is not spending time with the dog, then also it can happen. Or sometime because of the allergy, like environmental allergy, food allergy also can happen. So we have to check the acrylic dermatitis, whether it is even because of the obesity, because of the pain in the area, foot area, any orthopedic problem. All these things has to be identified and rule out one by one. If it is going to, so till that time, you have to go for treating the psychotropic drugs like amitriptyline, like that you have to give. Once you are going to give that, if it is going to show the improvement, and if it is going to be recurring, then we have to find out what is the cause for it and then avoid it. Okay.
If the dermatitis is primarily bacterial or parasitic and is now secondarily invaded by fungus, what should we treat first?
So that's what I told before. Actually, the same question has been asked and we have given. It is a secondary for any allergic or parasitic disease. We can very well go for having the combination of shampoos are there, antiseptic and antifungal shampoos, sprays are available. We can even the topicals are there. We can very well use that to control the secondaries. So I think we can finish it off.
Yeah. Now to conclude, I invite Dr. Venkateshwaran, Coimbatore Cotton City Pet Clinic, Vice President, IAVD, to deliver the vote of thanks.
Mute. You are in mute.
Yeah. Good evening, ladies and gentlemen. On behalf of IAVD, We sincerely thank the Drools team, the knowledge partner, for providing us an opportunity to learn every month. And I thank the Drools team, Dr. Ashish and Kritika, for conducting the session throughout in a nice manner. And AVD profusely thank Dr. Sandhya Bhavani for an excellent pictorial presentation in the facial dermatosis today. Thanks, Dr. Sandhya Bhavani. Finally, thanks to Dr. Nagarajan for providing an opportunity for everyone to learn. And finally, I request everyone to attend ICVD 5 from June 4 to June 6 in ITC Royal Bengal, where eminent dermatologists throughout the world, Dr. Douglas Debor, Dr. Annette Loeffler, Dr. Alberto Martin Carduro are participating, wherein we can learn a lot. So do come, enjoy, learn it. And thanks one and all.
Thank you, sir.
Thank you.
So before we wrap up, a gentle reminder to fill out the form in the comment box to receive your certificates. Thank you all once again for joining us. We look forward to seeing you all at the future sessions. Thank you.
You know, my friends and I, we talk about everything under the sun. So how can we leave out discussing something as important as our pets and their diets?
Always remember to check the back of the pack when it comes to buying food for your pets.
Make sure that you're feeding only real and clean ingredients.
It is 100% real chicken.
No byproducts
Or fillers.
All natural, all healthy ingredients.
It gives them the best of both, taste and nutrition.
Drools.
Drools. Drools.
Drools.
Drools.
Drools. Feed real.
Fit clean.